Hi and welcome. My name is Runjan Chetty. I'm the Chief Medical Officer of Diagnexia, a company which offers remote subspecialist clinical services utilizing AI. And we also have a very prominent education and outreach program. And as part of that program, we've developed a computational pathology course. And with that in mind, I'd like to introduce you to our Chief Scientific Officer, Dr. Pierre Moulin, who is the organizer and course convener. And today we're going to chat a little bit about the computational pathology course. So Pierre, welcome, and thank you for joining me this evening. Can you just tell us a little bit about computational pathology?
John, thanks for having me on this event. Yes, as you and I spoke previously, computational pathology is really close to my heart. I've started my career as a young pathologist, already interested in computers. It was back in the 90s. There was no such thing as AI or deep learning. Needless to say, there was no slide scanning. We were doing image analysis, I would say brute force, a lot of engineering, quite a steep learning curve. And I think the field of computational pathology, which was not named computational pathology back then, but probably just image analysis or histological image analysis, took a while to take off. Even lost momentum in around 2000 with the rise of molecular pathology, which really changed or the way we're practicing pathology today. We could not do without molecular pathology. And I think around 2015, 16, 17 came the deep learning, or at least the first application of deep learning. Deep learning used to be around for a while, but the first really groundbreaking application of deep learning in pathology and the development of this model and AI in pathology as we know it now. I think the term computational pathology made its way into the vocabulary around that time. And it's time for us pathologists to own it and to learn more about what's behind. I think we've made the effort to learn more about molecular biology for the purpose of being able to work properly with molecular pathology. And I strongly believe that now's the time for image analysis and computational pathology.
Sure. And in terms of how it's going to shape the future of histopathology and pathology practice in general, what are your views on that, Pierre?
But I think it's like every technology, we need to look at it with a critical eye. We need to understand what can be done and what can't be done at the moment, not restricting ourselves to what's possible today, but also looking at what the recent history tells us when it comes to what we can expect from image analysis and computational pathology. If you're looking at the current applications, some of which are deployed in the clinics, it's about helping with biomarker analysis like Ki67, ERPR, HER2, PD-L1. Very useful. They are taking mundane tasks from us, which is, I think, valuable, adding probably a certain level of robustness to the evaluations. We see also application of computational pathology in the field of cancer grading. Gleason and prostate cancer is the leading indication for computational pathology applications. Interestingly, we see methods of computational pathology deployed in the clinic for the purpose of determining the prognosis of patients or providing a surrogate to molecular testing under certain conditions. The interesting part of these applications is that they go faster than the molecular testing, and we can really make decisions for our patients quicker, at least in the range that's allowed by the applications, the conditions, or the how do you say that, the conditions of validity of these applications. But I think we need to be more ambitious then. We know computers can read morphology, and to some extent, there is this joke about pigeons can read morphology as well. I'm not sure if it's that simple. But what we see is definitely computers good at identifying morphological patterns. There is on that basis, if we think about how to combine different aspects of morphological analysis together, multiple resolution, different parts of a slide, multiple slides together, we can really dream of computational pathology helping us on a much broader spectrum of applications than what we see now. And I would say I see a future where not only I report the slides or I report my cases on a digital platform like I'm doing for Diagnexia, I'll be also helped by AI to report this case. I'll have AI making sure that I'm consistent in grading, in naming, in coding lesions. And I'll probably also see AI in a more distant future helping me with difficult cases.
Sure. And so, Pierre, one of the common misperceptions is that computational pathology and AI models are going to replace the role of pathologists. How would you address that, and also address the fear that pathologists are not going to be in control of the process once we have the diagnostic process, once we have these models?
Well, I think that there is something legitimate about that. We don't want to delegate the diagnostic process, the mental process we are going through when we make a diagnosis, to a machine without any understanding of what's going on. We need to build this critical understanding. And I think, again, molecular pathology gives us a recipe that's proven to work. We've predicted, or some people had predicted the end of pathology with the rise of the molecular era, and we have fully integrated molecular pathology in our practice. We know what we need to know about the techniques, also what we need to know about the molecular signatures of tumors or genetic diseases, as we need to critically assess the results coming out of these techniques. There is absolutely no reason why we would not be able to do the same for computational pathology. In that case, we won't be replaced, but it will be a new tool in our toolbox.
Yeah, I look at it more as a reinvention of our role rather than a replacement of our role. And I think and I totally agree with you that it's going to be a pivotal aspect of the future pathologist and should be started to be integrated into training programs. And in terms of courses out there to inform trainees and pathologists in computational pathology, what's available really?
Unfortunately, there is not much out there. On the engineering side and data science side, there are several courses about image analysis and histology image analysis, even deep learning for pathology. It's really unfortunate that pathologists are not tightly engaged or involved with these initiatives. On the side of where can a pathologist find the information and really be brought up to speed in the field, there is very little. We see a lot of webinars, we see a lot of conferences, or even, not online courses, but conversations like the one we're having now, touching on some subjects, but not really getting to the level of, to the depth that's required to create this understanding we were talking about earlier with the analogy of molecular pathology. I would say we've seen also several attempts to educate through papers in pathology journals. And again, the depth you need to really understand what's going on in the models or in the image processing in general is not reflected in these papers. It's really superficial at the level of the application. And I think the value in this literature, I need to acknowledge that there is a value in this literature, is really bringing people up to speed with what are the conditions of validity, or what are the tools we have available or promising in our environment. But it doesn't really teach you how to do it. Mm-hmm. And doesn't teach you or doesn't bring you up to speed with the relatively complex concepts you need to be able to master in order to critically review these type of things. I would challenge colleagues in the clinical practice to read the leading papers in computational pathology published in Nature Medicine or this type of thing. It's very much engineering. It requires a lot of knowledge in this field, in mathematics and in engineering. And I'm here to say that that's not an impossible task, and that's why we are proposing the Computational Pathology Symposium with Diagnexia. It's really to get into the weeds all together and bring pathologists along in this complex. It's a complex subject matter, but it's not something that's magic or something that nobody can understand without 5 years of engineering school as a background. That's not reach.
Yeah, certainly there's a certain amount of mystique with any new technique or innovation that hits our field. And I think it's very important that we try to understand. As you correctly say, I don't think we want to create engineers and mathematicians and data science, etc. But I think as pathologists who utilize computational pathology in the way we practice, understanding the fundamentals at least is critical. So last year we had the introductory course to computational pathology, and based off the success of that, we've now developed that introductory course into a 2-day full. Can you briefly tell me what the difference will be between the two courses, and then what the course entails?
Yes, as you said, the first edition was last year, 1 day, and we've learned a lot by delivering the courses in that context. We've realized that 1 day is probably too short to deliver the full content we need to deliver, and also for the attendees to, assimilate the right concepts. So in a way, it went last year deeper than any other initiatives I've heard of. I mentioned previously, but it was probably too steep of a learning curve as well. So this year we'll split that, or we'll spread that over 2 days. First day starting with the image fundamentals and classical image analysis. Really take the time to understand what's the digital image and what does it mean when we are making measurements and out of that. to build a strong foundation for day 2, where we'll get into deep learning.
All right. And there are practical aspects also involved over the 2 days. Can you briefly chat about that?
Well, yes, we'll see use cases of the different techniques. We'll illustrate the different techniques, the different mathematical tools we need to use with pragmatic cases in pathology. And I think also, if any attendees want to have more hands-on experience, we'll be happy to guide them step by step during specific moments in the day.
All right. And so they should just bring their laptops along to facilitate.
Bring your laptop along, and we'll take you by the hand.
Sure. And in terms of at the end of the course, what would you say, A, to pathologists and trainees that they would take away, and B, what they should do next?
But I think my ambition is that at the end of the course, you'll get the notions that help you get into any paper. You'll know where to look for the information. You'll get a structured knowledge, a piece of knowledge, a first seed for the knowledge you're built by yourself later on. Really, the idea is that at the end of the 2 days, one of these mysterious papers I was referring to 10 minutes ago will be no mystery for you.
Sure. So the course is CPD accredited by the Royal College of Pathologists, and they will get a certificate of attendance at the end of the course as well. So if anyone has aspirations in really delving deeper into computational pathology, this could be a very appropriate stepping stone, not so?
Absolutely, and we'll give also the participants the links and the reference to the educational pieces they could choose to take later on. But they will get really the foundation. They will be able to do a few things, but understand most of the things, or most of the concepts around computational pathology today.
Right. So the course is in August this year, August 18 and 19 at the Queen's College in Oxford. They're 2 full days. The accommodation and meals, etc., are at the college and inclusive within the registration fee. So remember, it's the 18th and 19th of August, 2026. And there's also a social program associated with it in the evenings. So we do have, a reception, and following on from the computational pathology course, we will have dinner together, and there's a gala dinner, and you can also attend Diagnexia Histopathology Symposium at the same time. But it is an opportunity to meet the speakers, ask questions such as Pierre, and get into greater depth in areas that are difficult to understand. And Pierre, in terms of the faculty that are presenting, do you want to quickly tell us about and who they will be?
Yes, we are very fortunate to have Professor Runjan Chetty working with us on these 2 days, and the attendees will have the opportunity also to meet computational pathologists, as I would name them, fully qualified pathologists and computer scientists, sharing their experience, but also delivering a part of the course. And I think having the opportunity of the 2 days and the gala dinner in the evening to interact freely around the content, or also career aspirations, or what's the next step for me, and these kind of things, these kind of topics will be very interesting for the attendees and very interesting for us as well.
Thank you very much, Pierre.